Rhinoplasty is an artistic surgical procedure to change the overall appearance of the nose. One of the more common reasons a person seeks out rhinoplasty is to address the bump along the bridge of the nose. That bump is usually bony in nature. The traditional technique to remove or reduce that bony bump is to use a chisel and hammer to break the bones. The chisel is placed at the edge of the nasal bones, and then the hammer is used by the assistant, tap tap, tap tap, tap tap, to break the nasal bone and reduce the appearance of the bony bump. This technique results in soft tissue trauma and subsequent increased bruising and swelling. To reduce the width of the nasal bones, a curved guarded chisel is placed at the side wall of the nasal bone, and this chisel and hammer are then used to narrow this bone. Tap tap, tap tap, tap tap. This may result in pronounced swelling and bruising in the cheek areas. Occasionally, the top part of the nasal bone needs to be fractured in order to further narrow the nasal bone. This is accomplished with the chisel placed at the top part of the nasal bone and a hammer used by the assistant. Tap tap, tap tap, tap tap. To refine the edges of the nasal bone, particularly in thin-skinned patients, a handheld broad rasp is placed underneath the skin, and multiple strokes are used to smoothen those bony edges. After years of using chisels and hammers for rhinoplasty procedures, these new advanced instruments from Bien-Air provide both promise and enhanced outcomes for both the patient and surgeon. We will now demonstrate hump resection using these power-assisted instruments. Instead of using the traditional chisel and hammer method, this instrument will allow us to make precise cuts and will only remove the necessary bone with minimal trauma. Rather than using the guarded, curved chisel to break the sidewall of the nasal bone, we are able to reduce the width of the nose using specially developed angled blades to make precise cuts on the sides of the nasal bones. Occasionally, we now use oscillating blades to make precise cuts at the top of the nasal bones to further reduce the width of the nose without substantial trauma to the surrounding tissue. These instruments provide cooling as well as removal of debris with built-in irrigation. Finally, we can precisely smooth bony edges by using a set of micro rasps instead of using broad, wide files. These automated rasps only reduce the necessary areas rather than filing the entire area with the handheld rasp, again decreasing trauma to the surrounding tissue. With the Bien-Air powered-assisted instrumentation, we are now able to take down the bony bump of the nose in a precise manner and eliminate the need for a chisel and hammer.